Hi and welcome to the Dynamika webinar. My name is Robert Riis. I'm a MD and a PhD student at the University of Copenhagen here in Denmark. And I'm writing a PhD on inflammatory changes in knee osteoarthritis, and we're using dynamic MRI and using Dynamika to analyze those dynamic contrast enhanced MRIs. So let me take you through an analysis of an dynamic MRI, one of our patients or participants in a weight loss maintenance study. It's a 74-year-old female with knee osteoarthritis and pain, of course. So when you log on into Dynamika, this is the first window you'll find, the data finder window, and actually it reminds you a lot of PACS. So up here you have the available studies, and what you need to do is to select one of them you want to analyze and just add it to your work list down here. So that's the first step. Then you proceed to the next step, and you can either click next or just click the next available window on the left hand side. So we just click here, select series, and here you'll find the dynamic contrast, or the available series. In this case we only have the dynamic series, so there's not too much of a choice, so we just select that and click next. The next window is the patient motion correction window, and patient motion correction is necessary in order to reduce the signal to noise ratio. So what you find here is the dynamic sequence. On the right hand side you have a vertical bar where you scroll through the series, and on the bottom you have a horizontal bar where you select the time frame. And as you can see, the first time frames are without contrast, and as we proceed through the time frames you will see how contrast now appears in the popliteal artery. So what you want to do is to select one of the last time frames in order to make sure you have contrast in the knee, and then you just place the cursor over the popliteal artery, and what you see in the upper part of the window is a signal intensity graph of that specific voxel or where the cursor is placed. What you want to do as to choose a reference frame is you want to choose a time frame in which the contrast already has reached. So what you do is you count, just double click here, you count. So now you have the yellow dot here represent this signal intensity graph. So you count 1, 2, this. 1, 2, 3, 4, 5, 6, 7. So on the 7th time frame, the contrast for sure has reached the knee. So you choose here on the left hand side, select reference image frame, you select 7, and then you click run. And what it does now is performing the motion correction with time frame 7 as the reference image frame. And this takes a couple of seconds, maybe half a minute or so, and you will see it appear here on the right hand side, the motion corrected sequence now. And you can see it running. You can also choose to show the progress if you like, how it works through the slices. And we're done. So now you can see the motion corrected image appears here on the right hand side. You select the motion corrected image. If you click here, you can see the the red frame around the non-patient corrected image. You want to do the analysis on the motion corrected image, so you make sure that the red square is around the motion corrected image. And then you click next to proceed to the next step. The next step is the calculation of the parametric maps, that is the initial rate of enhancement, the maximal enhancement, and so on. So again, here you have your dynamic, now patient motion corrected image. The right hand side you have the vertical bar where you scroll through the sequence, and on the bottom bar, the bottom horizontal bar, is the time frames. So again, what you want to do is to define a baseline, that is a baseline before contrast reaches the knee. So what you can do, or what you do, is again you place your cursor on the popliteal artery. You can double click it, and the signal intensity graph for that yellow spot appears here on the bottom right corner. What we do now is you need to make sure that you select a baseline where the contrast hasn't reached the knee yet. And what we do in order to standardize all our analysis is that we choose the first 3 time frames. So what you do is you enter in the baseline field, you enter 1, 2, 3, and then you click calculate. And that takes it is already, and that will take a couple of minutes as well. Why we place the cursor here in the popliteal artery is to make sure that the contrast hasn't reached the knee yet. Maybe if you do dynamic MRI of the hand and wrist in, for example, rheumatoid arthritis, you'll be able, the contrast reaches the wrist very quickly, and so you have to make sure that when you define the baseline, it hasn't reached the wrist or the joint you want to analyze yet. Again, you can show the progress. As I mentioned before, this takes a couple of minutes. The next step after the parametric map, the calculation of the parametrics map, is actually to draw the regions of interest, the ROIs. And what we use here in Copenhagen is that we have, next to this Dynamika window, we actually have a DICOM viewer next to that, in order to make sure that to check the anatomical boundaries and to make sure that what we think is, for example, the patella truly is the patella on the static images. So we have a DICOM viewer where we look at the static images at the same time as the dynamic images that are analyzed in Dynamika. So now we're all done with the calculation of the parametric maps. We'll just skip those steps here and proceed directly to the drawing of the ROIs. Just click here. So this is a window where you draw all your ROIs. Again, it's the same way. Bottom horizontal bar is the time frames, and the vertical bar here on the right hand side is scrolling through the MRI. So what you can do now is actually you can just start drawing immediately. What you need just before doing that is you want to choose which shape the ROI you want it to have. So we do all our drawings freehand, that is with the mouse. So what we do is click polygon mode, and then you can draw around, for example, this muscle. I guess it's biceps probably. I'm not. And you can just draw around the muscle like this. When you're done with that, you just scroll or just click the next image, and you do the same. You have to choose polygon mode again, and then you draw around the muscle of interest again. When you've drawn the ROIs, they will appear up here in the slice ROIs window. And when you're done with an anatomical structure, what you can do is actually group the single slice ROIs into a volume of ROIs. So now we've drawn, I could just draw one more. Like this. Now we've drawn ROIs around the biceps in 3 different slices, and then you can group it as a volume. And you just click group as a volume, and you can see all the drawn ROIs are checked. Group as a volume, and you can call it biceps. And then you can proceed drawing around other structures. So the muscle usually, in this case, is the contrast between muscle and fat is actually quite good. So it's quite easy to draw around the muscle. It might be more difficult to draw around the synovium, for example, or bone marrow lesions. And then the parametric maps might be very helpful. So up here in the upper left corner, you'll find a window where you find all the parametric maps. So you have the gadolinium map, you have the time of onset map, and you have initial rate of enhancement map, as you have the maximal enhancement map. We use mainly the initial rate of enhancement. So you can click this initial rate of enhancement, and then you'll see how the voxels are color-coded according to the value of initial rate of enhancement. And the initial rate of enhancement, that is, just click here, that is the upslope on the signal intensity graph. Down here in the bottom left corner, you can mask the initial rate of enhancement more or less. So actually, if you just turn it on a little bit, you will have quite a good idea of how, in this case, the synovium is delineated here. So that makes it actually a little bit more easy to draw ROIs around the synovium in this case. So that's what we're using the parametric maps for here in the ROI drawing window. And again, you can do the same. You click the next slice, choose the polygon mode, and you draw ROIs around the structures. And with the initial rate of enhancement map turned a little bit on, it makes it quite a lot easier than if you turned it completely off or just chose no parametric maps, as you might notice. Again, when you're finished drawing around your anatomical structure, you can choose to group them all as a volume of ROIs, and you can call it synovium or synovitis if you like. That you can do around a lot of different anatomical structures. So around the synovium, around the muscles, around bone marrow lesions as well. And let me just show you an example of bone marrow lesions. And bone marrow lesions are quite difficult to draw around. And again, the initial rate of enhancement might be very, very helpful in order to draw, to find and differentiate the bone marrow lesions from the adjacent bone. So here again, with nothing turned on, no parametric map turned on, it's quite difficult to find the bone marrow lesion or more or less define it exactly. So again, we choose the initial rate of enhancement map, turn it on a little bit, and then you'll see how the bone marrow lesions are quite or have very high values of signal or initial rate of enhancement, and that makes it somewhat easier to draw around. I would do one around here. Let me just, and you have some more bone marrow lesions here in the medial compartment of the knee, and you group that again, and you just call that bone marrow lesion. So now we've drawn rows around the synovium and the bone marrow lesion and the biceps. And when you've done with all the rows, with the drawing of the rows, what you do is you proceed to the next and the final step, that is the report generation, generating the reports. So this is the final window, and here you can choose what report type you want to use, and we usually only use the Excel format. That makes it easier when you proceed to the data analysis and the statistical analysis. And then you just simply click Create Report. And this takes a couple of, or a minute or two, depending on how many rows you've drawn. And what it does is that it generates an Excel file with all, here we have it, and we can just choose to download it. And maybe you can, I'll just open it. I think there it is. It will give you all the perfusion variables for the single rows and the volume in total. So here you can see the volume, the biceps, that is this row, biceps row, and this row, biceps row, and this biceps row collapse into a volume, and you will find all the number of voxels. And if you go on to the right, you will find a lot of perfusion variables with the initial rate of enhancement, the maximal enhancement, and so on. When you've saved that file, you can just choose to go back to just click Finish, and you will go back to the Select Series window. And if you're done with the analysis of that specific MRI, just go back to the Data Finder window, and then you can remove it from your work list and choose another patient. So it is quite simple and user-friendly to use, this Dynamika, and very step-by-step setup or version. So it is actually quite easy to use. So I hope you will give it a shot and try to analyze a couple of dynamic MRIs. And if you have any questions, feel free to contact one of us. We'll gladly try to answer your questions, and I hope you'll have a lot of fun using Dynamika. Thank you for now, and until then, bye.